I wanted to welcome everybody to the Awakening series. Today we have Hilary Morris with us, who is a certified LPC, board certified clinical counselor for the past 7 years. Hilary has provided clinical and forensic services. Hilary is also a somatic therapist in her own private practice and specializes in treating trauma and post-trauma stress order. Hilary, welcome to the show. We're so happy to have you on the show. Hilary is actually a personal friend of mine, and I am so wowed by this amazing woman and honored to have her on the show. Thank you for being on the show.
Yes, thank you for having me. Excited to be here.
Wonderful. Well, Hilary, if you can give us a little bit of insight on your journey, we'd love to know more.
Hi, I'm a clinical therapist, and I, about 5 years ago, developed my own private practice, and about 2 years ago, was able to move into full-time private practice. And I provide clinical and forensic services. And what forensic services means is that I provide psychotherapy to individuals who got injured in some sort of event and are now in a legal proceeding to assist with their injuries. And additionally, I also specialize in the treatment of post-traumatic stress disorder. And I provide somatic therapies, including EMDR. It's a very common one. And what somatic therapies means is it's a body-based therapy, because with trauma or with an emotionally traumatizing event, we store our trauma in our bodies. And so sometimes we have to bypass just talking about it or just conceptualizing it with our words, and we have to sink into how our body is holding that. And so that is what my private practice specializes in.
I learned a little bit more about your practice in regards to ketamine. Can you tell us about working with ketamine and clients and how that goes together?
Yes, so I am also a certified ketamine therapist, and there's many different ways that practitioners can work with ketamine, and mine is a little bit unique in that I provide what's called ketamine-assisted psychotherapy. And ketamine is a dissociative anesthetic, and it's also a psychiatric medication that in March of 2019 was approved by the FDA to help out with treatment-resistant depression. And so in addition to that, some practitioners are also using it for things like to help with anxiety, depression, post-traumatic stress, and even spiritual exploration. And so in my practice, I use it a little bit differently because I mainly deal with populations that are struggling with anxiety, depression, and post-traumatic stress. And so I use it to gently augment the traditional cognitive behavioral approaches, and then the somatic therapies kind of on the back end to help clients take their recovery a little bit deeper and help reclaim certain aspects of emotional control over their bodies. So one example is with post-traumatic stress, one of the things that makes it so distressing for my clients is how quickly a trigger can offset a panic response. So you have a trigger and then a panic response, and it happens very quickly, and it creates the illusion of loss of control of the body and loss of control of emotions. And so what we do in the work that I do is we help clients gain emotional control. We help do some desensitization around their triggers. So we're essentially decreasing the emotional charge of that event through some of the therapies. And then on the back end, once they've created a stable foundation, then we'll add the ketamine to help the body to learn that the body is safe. Because one of the common beliefs with trauma, with emotional trauma, is I am not safe, my body's not safe, I could go into a panic response at any moment. And so the biochemical impact of the medication of the ketamine and the how it sits with the nervous system really beautifully augments and dovetails some of these traditional therapies to help reclaim and kind of reset and deepen some embodiment work. And embodiment means it just makes these truths kind of true in the body and makes it feel true in the body so that clients can actually feel safe in the body. They can feel calm in the body amidst some of the things that highly triggered them. Does that make sense?
That makes so much sense. As far as the ketamine itself, what, like how much does somebody take? I mean, I'm sure it depends on their weight, and I mean, how do they go through maybe like a checkup? Is that what they do to before you administer the ketamine?
Yep. And so my protocols are a little bit unique in that with the ketamine assisted psychotherapy, it does require medical clearance from either a psychiatrist or a psychiatric nurse practitioner. And so I will usually say that we have at least 5 sessions before we integrate the ketamine work. And so in those 5 sessions, we work on recognizing the individual's own trauma response, recognizing their triggers, working on de-escalation strategies, working on grounding strategies, working on basically expanding the capacity of their nervous system and helping them to heal on that level. And so then the patient will need to get medical clearance from a psychiatrist or a nurse practitioner, and it's actually the prescriber who will give the clearance. So then once the prescriber has said, because they do their evaluation and look for pre-existing conditions or just make sure that medically the individual can take the ketamine. And so once that happens, then the prescriber prescribes sublingual lozenges, or the clinical term is called a troche, TROCHE. And dosing is handled by the prescriber, and the prescriber takes into account all sorts of things: weight, psychiatric, clinical history, medical history, all of that. And then they prescribe them lozenges. And then the clients will bring those lozenges into my office, and they will ingest the medication. Well, typically I do 15 minutes of intention setting. So we'll go into what are your intentions for this space? And we sort of set things up. Some clients will want to bring something that's special to them for that space, since we do a lot of healing and we have some vulnerable conversations. Sometimes people will bring in a rock or a photo of their loved ones or a candle. So we really set the stage. And then the client will ingest that lozenge, and the total time under the medication, it's a very quick therapy. So some of the other traditional psychedelic medicines are longer. So if you talk about working with psilocybin in clinical research trials or MDMA, those are more 4 to 6 and then 8 hours. But the ketamine is very quick. You get in and out in around 2 hours, especially keeping it at a lower dose, which is what my prescribers typically recommend for the patients that I deal with. So we have a lower dose, and they can get in and out of the session and in and out of the medical experience or the medication effects in about 2 hours. And so they take that, and when they take the medicine, so a typical session would be, we set the intentions, and then they ingest the medicine. And then during that time, we have headphones with lyricless music, so headphones with very calming music to aid the process. And they also have eye shades on. And the reason we have eye shades on is to filter out excess stimulus, because we really want the clients to go inward for this journey. And we really want them to access their own inner healing intelligence, because we know with somatic-based therapies, and we know with some of the therapies that I specialize in, the body knows how to heal. Just like if you were to get a paper cut and go into a doctor to help you heal your paper cut's going to heal because of the inner healing intelligence that your body undergoes. And so the same is similar with psychological healing, is that we get in touch with what our body needs to do. And in my world, that comes with releasing trauma and memories that need to be get brought up to the surface. And so the reason why we have a very controlled environment with eye shades and with music is to filter out excess stimulus and really get the patient focusing on what is going on in their body. And usually they've laid a foundation, they've done some of the desensitization or the deep trauma processing. And so on the back end, we're really embodying body is safe. What would it look like to claim safety in your body? And this could be in so many different realms. And sometimes things come up that we don't even think about. it's really an act of surrender. And so we set the stage, but ultimately whatever comes up is coming up as an opportunity for healing. And I really encourage clients to open up, let go of control. It's almost like you're floating down a little river, a very gentle river. It might have little twists and little turns, and the client's job is just to let go. And it can be scary for some, especially individuals. I mean, we all have trouble with letting go of control, but I think the real beauty of this work and this type of therapy is it helps clients to really trust that they can hold themselves. And I can hold them. We really create a space of safety and trust, and the work that comes up is beautiful. And I've seen clients face a lot of scary things, and a lot of things, whether it be traumas in their own life or even expansion. Sometimes we think of growth and expansion as rainbows and butterflies, but there's fear that comes with growth, and then we want to make sure that they can handle that as well.
Would you then suggest them going here or there or wherever the case may be before you work with them?
Absolutely, yes. So oftentimes, and I actually, because of the type of work involved with ketamine, I really only accept clients with a physician referral or with another therapist referral. Those are typically the best clients, because a lot of times clients will be so intrigued by the treatment, which is understandable. It's a very, very powerful medicine. And sometimes they'll be so enthused and want to jump right in, and that's okay. And there's a lot of enthusiasm, and there's a lot of regulation on who this is appropriate for. So it's got to go through the proper channels with getting the right types of referrals. And so in the way that we do it, I require either a therapist referral or a physician referral as well, just to establish the medical necessity for this work. And some of the therapists in the network, they know the way that I work, and I'm a little bit different too in this space because I'm doing trauma work, and trauma. There's a whole spectrum of trauma work, and so to provide the best level of care, that's the protocols that I adhere to.
If you can give me your insight on why it is so important to keep up with your health in regards to mind, body, and soul, coming from your position.
Yes, I think that's a great question, especially with what's going on in the world with the pandemic. But I think health is so essential to overall wellness. And I think mind, body, and soul and spirit, those are all connected. And if we deny one of those, I think things can get thrown off balance. And so I think if we can tend and turn inwards to what we think we need, I think that can be very, very powerful. And I think a lot of times what happens, and I see this in the clinical world, and I fall into this too as a therapist, is we get caught in the trap that healing mind, body, and soul comes with external things. So things like, I just need to get on a program, or I need to get with this person or go to this practitioner. And yes, that can be helpful if it's directed from within, because we tend to think, healing is external. My healing will happen when I do this, or when I do this, or if I just do this program, or see this doctor, or see this. But what we forget in that process is to tend to the inner pings that we get for what we really need. And so I think I would just encourage all of us, including myself, is to just really tend and ask yourself, what do I need in this moment? What would help accelerate my healing process in this moment, coming from what my own inner healer is leading me to versus maybe what I've been socialized to think or what I've been told will help me, because we all do it, and it's really easy to buy into a program or a method or something external. But when we start to tend to, my healing can be internal, and sometimes that might be, so an example would be, sometimes there might be a temptation to follow a really strictly regimented workout program. I'm going to get up at 6 a.m. and work out every day. And for some people that works. And sometimes it's, I'm going to get up at 6 a.m. and work out because my body really wants to. But sometimes I'm going to get up at 6 a.m. and do a light dance flow or do a light yoga practice or do a body opening meditation. And my program would say that I'm failing because I'm not doing this regimented thing every day, but my body actually doesn't need the high intensity workouts at 6 a.m. Today, my body needs to just do some light interpretive dance or to just do some meditation. So I think it's all about just, and there's a balance too, because we want to be disciplined and we also want to tend to what we really need. And I think that links into some of my work. It's called embodiment practices and really embodying. So what is health? Not what does health look like from how somebody else might define it, but what do I need in my life to have ideal health? Maybe I need connection. Maybe I need to meet with my girlfriends once a week. Maybe I need time in the bath to soak. Maybe I need introspection. Maybe I do need to go talk to a therapist or a counselor. It's just whatever is coming up and what is most potent for you in that time.
I love that. Thank you so much. Well, if we can get into something a little more personal, if you can give us some insight about your daily routine, I think that would help us out a little too.
Yes, my daily routine. It's changed so much since COVID happened. But what I've started to do is I've actually started to set a regular wake up time for me. And I own my own business and I'm self-employed like you. And sometimes it could just be every day looks different, but it really helps me to actually have a routine and wake up at the same time. And so I started getting up at 6 a.m. and then I like to move my body in some way. And I really enjoy going to the gym and doing some gym workouts. And I also really enjoy doing movement. And so I usually wake up at 6, move my body in some way, whatever that looks like. Sometimes I'll do a light yoga. Sometimes I'll do Pilates. I know we've talked about that. And so I'll do that. And then usually when I get ready, when I'm getting ready after the gym, I love talking to my girlfriends while I'm doing my makeup or doing my hair. And so I'll just have conversations on WhatsApp or Marco Polo with some of my girlfriends. And that really fills me up too as I'm getting ready for my day. People, including you, I know we've had our little WhatsApp chats, but that's really fun and a fun way to multitask and get some connection in while I'm getting ready for the day. And then usually I'll come into work, see clients, do my work routines, and then I'll come back and I'll come home. And usually my nightly routine is pretty similar. So sometimes I'll just kind of tend to whatever I need. Sometimes that's making a really nourishing dinner. Sometimes that's meeting up with my girlfriends or meeting up with my loved ones. Sometimes I really, really love baths, especially with COVID and also with how cold it is. So I'll do candles and bath salts and oils and just do a nice bath with some nice music. But that's typically what my routine is, but I'm not so attached to it. But it does help me to have kind of those daily things to help get me going too.
That's lovely. That's so nourishing. I like that word, nourishing, you just mentioned. And I'm sure because it's winter and during summer, you're probably going to be out and about more and your routine will change. So being open to change is always great. What are your favorite books personally? And then what are your favorite books as far as psychotherapy goes, if you have any?
Yeah, so personally, one of my favorite books that I keep going back to is Untamed by Glennon Doyle. I think you and I have talked about it, but it's one of my favorite books. I think she's such a powerhouse, and she kind of talks about the roles that women have played historically and what it looks like to step out of different roles, women as people pleasers, women as martyrs, women as just saying yes all the time and stepping into a role of empowerment. So I love that book personally. I keep coming back to it. And I also am starting to read more poetry. And so I read a lot of Rupi Kaur. I don't know if you're familiar with her work, but she has just such lovely sonnets. And so before I go to bed, sometimes I'll read just a couple, or sometimes I'll send them to people and be like, oh, I thought of you when I read this. But I just love the poetry. And that's so different for me because I used to love the dense, intellectual, just so much content. And now I just really like things that are just really easy and soft. And so I really like those.
That's awesome.
And then professionally, so I work in the trauma space. And so a lot of times with my clients who are doing body-based work and body-based healing, I'll recommend some of the classics. One of my favorites is called The Body Keeps the Score by Bessel van der Kolk. And that's kind of a classic in the trauma industry. It's just all about how we store trauma in our bodies and how trauma healing oftentimes bypasses cognitive processing, because sometimes people, and we all think that, oh, I had this traumatic event happen. I was in a horrifying car accident. I almost died. I maybe saw some horrific things, and I keep talking about it and keep talking about it and keep talking about it, and nothing changes. Well, that's because we hold trauma in our bodies. And so sometimes we have to just allow our bodies to release and reprocess that trauma and let our bodies take control and let our emotions kind of follow with that. And so that book really provides a lot of insight to that. And a lot of clients will say, oh, I get it. That makes sense. And it explains this concept really well about dissociation. That's another concept that comes up in the trauma space. It's called dissociation. And what that means is sometimes when we have a very traumatic experience, or when we have multiple traumatic experiences, we, in that moment, it's almost like we leave our bodies, we check out, so that because of the magnitude, the emotional magnitude of that event is so high. When we face death or when we have a scary event, we can't take it. It goes beyond what our bodies can process. So we check out, we dissociate. And that book gives a beautiful illustration of what happens, because it is helpful to talk to clients about this process, because the more they can know about it, the more they can recognize, oh, this is a dissociative, I'm dissociating now. And the key to treating trauma is we actually want to minimize the dissociative episodes and get clients back in their bodies. And that can be very scary, because when you dissociate, it's a survival mechanism. You check out, and that's good, because you're able to distract from this emotional, intense event. And so getting back into the body is actually how we clear that. And so that book is a really beautiful illustration of someone who was sexually abused. And what happens when you're involved in sexual trauma is there's this beautiful drawing of the event happening in her bed, and there was like a bubble, and she kind of lifted out of that, and she was almost watching herself getting abused from almost the corner of the room. And so just explaining that to clients, help them understand that this is a survival mechanism. This is how you made it through. And this book really speaks to that too, because ultimately we want to reduce the dissociative episodes so that you can get back in your body, which is very, very scary. And so that's how we clear that trauma. And that's the other piece. We're talking about the ketamine earlier, and that's the other piece that I wanted to touch on, is that healing, and especially healing trauma, it's not all rainbows and butterflies. It's very, very common in this space because if you stop dissociating, that means you're here and you're feeling. And so oftentimes we face things, or our clients face things like pain, trauma, devastation, loss, loneliness to a high degree, and that's scary, but we don't stay there. So when you can face your pain, or when clients can face the pain, completely surrender to the loss, the pain, the devastation, the fear, the panic, then that opens them up to releasing that and letting that go. And it doesn't happen overnight, but the more that's why I was talking about, we want to slowly expand the capacity of the nervous system to be able to tolerate holding these big emotions, and not only holding them, but knowing that it's safe to hold them. And that's the part of the co-regulation that happens with me as a therapist. I can hold space and witness your process as you face some of these really difficult emotions. And so that's why with the ketamine, we want to wait to introduce the ketamine until we know that you're able to hold these difficult emotions on your own. And then on the back end, the ketamine can help kind of reestablish, okay, this is safe, body is safe. And so that's something I'm pretty transparent about with clients too, is that they come to me because they want to be healed. They want something different. They're stuck. They're maybe stuck in these trauma patterns or trauma responses. And in order to heal, and the way that I treat clients is through grounding and resourcing them, and also teaching them how to open up to these horrifying and these traumatizing events. And that's how we heal. So that book is one of my favorites because it talks about that. And then the second one that I really love is a book called When the Body Says No by a physician named Gabor Mate. And he's kind of a famous physician in the trauma space. And what he writes about is that sometimes when we have physical trauma, it can manifest as, or when we have emotional trauma or even physical trauma, it can manifest as a physical illness. So if we have years and years and years of childhood abuse, for example, our body holds that, and it can be manifested in all these different things. And it can be manifested as autoimmune disease or clinical depression or clinical anxiety or chronic migraines. Or so sometimes the medical conditions can be linked back to continual trauma. And so sometimes that's helpful for clients because when we do the deep trauma work, sometimes they'll notice, oh, my chronic migraines are going away. Or, oh, I recognize that as I'm doing more of this work, I don't have as many skin flare-ups or something like that. And so that's a really powerful resource that I will recommend to my clients as well.
That's wonderful. And we'll definitely have those books down below on this YouTube video. You'll see the books and the authors. Thank you so much for describing and going so in depth. I actually will be reading those.
Okay, well, let's go.
Yeah.
Let me know how you think of what you think of them. They're wonderful.
I would love to. I'm so excited, actually. So what is your favorite part about being a counselor?
So my favorite part is the transformation, because I'm in the transformation space. That's what counseling, that's what psychotherapy is people come to me for change, and their best efforts have gotten them to where they are. And in order to have something different in their lives, they have to do something different. And so that's my favorite part, is the transformation. And the transformation, it doesn't happen without work. And my clients are some of the bravest individuals that I've met, because I've seen some of these people work through some very, very difficult core traumas related to so many things. They've gone through either car accidents, or some of them have fallen from walls, or fallen down and really faced death, or had things fall on different body parts. And some of them have had sexual trauma, and they face it, and it's so brave, and it's an honor to be a part of that process. And it does take trust, and I take that very seriously, that clients, they trust me, they trust. And I tell them that in the first session, that this relationship between you and I has to feel safe, because we are going to be talking about things that are so scary. And so there has to be safe. And what do you need from me in order to help create a container of emotional safety? And so that's definitely my favorite part, the transformation. And the transformation, it doesn't come like that. It doesn't come easy. We want it to. We really want it to, especially in this instant gratification culture where you just want change and want it yesterday. And it is incredible. I'm honored to be a part of that process, and that's the clients that I work with, and especially because I do a lot of work with women, and the things that the women that I work with, they just watching them to really connect with their own sense of what it is to be feminine. And I work with feminine intelligence principles. So just watching them reclaim different aspects of their femininity, or their sexuality, or their sense of empowerment is they're the bravest people I know. And it's amazing to be a part of.
That's amazing. That's beautiful. Thank you so much. So what is next for you, Hilary?
Yes. So next for me is, so we've had some growth here that I think I told you about when you were still here in Colorado. We've got a new therapist working with our practice here. She's a brain injury specialist. So she helps with the brain injury side, and her name is Michaela. She's fantastic. And then I'm also launching a second company, which you're aware of as well. It's a Hilary Sparrow Group. And what we're doing there is that I work with other therapists, so high performers, healers, thought leaders in the therapy space, and we use different models to help accommodate their own personal growth and their own professional growth. Because as therapists and as healers, we're so used to holding space for everyone else and supporting everyone else. And sometimes with therapists and private practice, we get burned out. And then when we get burned out, we work on the evenings, we work on the weekends, and then practices just they can crash and burn. And so I really work with that population. That's one of my passions, is working with other healers or thought leaders in this space to come alongside them and just teach them to focus on that it is possible to have a private practice and also have freedom, leisure time, travel, time with loved ones, time with kids. And a lot of therapists think that it's not possible, and it is. So that's one thing that I'm really excited about too.
That's so exciting, and I'm so excited for you. So, quick question. You're very welcome. Before we get going here, what advice would you give your younger self, if you would give yourself advice?
Yes, I would say if you have an idea, to go for it, because I used to be so, because I have a lot of big ideas, and I think maybe we all do, as I'm a female business owner and I'm an entrepreneur, and you probably maybe can relate. I had a lot of big ideas, and I would just get scared that, oh, no, this won't work. No one will understand. This doesn't make a lot of sense. And I would say if you have a big idea, just go for it. You don't have to know every step of the way. And one of my big ideas was to make my own practice and go into business for myself. And I had an idea, and it worked, because here I am, 7 years later, and it worked. And so I would say to my younger self, just, if you have an idea, go for it, and don't be so scared about what other people think, and which is something I'm still working on. And once you take one step in your idea, the next step will manifest, and then the next step will, and then the next step will. And that's how liberation happens, I think.
Absolutely. That was wonderful and powerful. And congratulations on everything, on all of your success. If you would like to talk a little bit about anything that we didn't touch on today, please, the floor is yours.
Yes, I think the other thing that I'm really expanding on, both in my private practice and then also this new company, is my work with women. And I really have a passion for working with that demographic because of, well, I am a woman, and so I can relate on that level, and especially working with women business owners and women entrepreneurs, because we're different. We're different. One, we're different as women, and two, we're different as entrepreneurs. And so when you combine those, female entrepreneurs, that's kind of its own breed. And I've been doing some research just from Small Business Association on small businesses. And there's actually, in terms of business owners of small businesses, there's twice as many businesses owned by men as women. So statistically, there's less of us around. And so one of my passions is helping provide support to women entrepreneurs, and specifically helping them and working on feminine intelligence work, because you and I have talked about this before, but running a business and being an entrepreneur, it does require a lot of heavy masculine energy. So leading, initiating, planning, productivity, those are all really important things. And that's how we operate. I think that's how you make a successful business. And what does it look like to incorporate things like softness, things like flow, things like surrender, creativity, tenderness, all of these things. And everything looks different depending on each woman that I work with. That looks very differently, but there are ways to incorporate both and to have a balance of this heavy masculine that has helped us all with building successful businesses and opening up to other things. So I love being a part of that work with women, and I love being able to witness how they can soften. And it's so funny, because one of my other really good friends, who's also an entrepreneur, she said, my business has seen the most growth when I've just surrendered, just kind of let go of a little bit of control. And I've experienced some of that too. And we just want to control every little thing, and that's natural. And sometimes it's just letting go, which might not be the best business advice depending on who you talk to, but you balance it out. And so that's one thing that I love being able to do. And I'm honored to be able to work with just wonderful powerhouse women who are entrepreneurs, who are changing the world with their businesses like you. You're amazing and incredible, and you're beautiful. And I just love, I'm so honored to call you friend too. And I just love being able to be a part of that, and also to provide a space for women to support each other, because it's different. We're different. And I think that because we are women, I think it's a selling point, and it's a competitive advantage, I think, in a lot of spaces. And so I just love when women come together and can support other women as well. And I love, love, love being a part of that too.
That's beautiful, and we all love you being a part of it and bringing us to the next level. So thank you so much. So tell us where we can find you, social media, are you your website, all that good stuff.
Yes. So my website for my clinical practice is www.hilarymorrislpc.com. That's probably the easiest way to find out about my practice. And then my new company, Hilary Sparrow Group, did consulting for therapists and high performers. That's hilarysparrow.com as well. So those are probably the easiest ways to get a hold of me and learn more about this work.
Hilary, you are such a beautiful, amazing, intelligent, brilliant, funny, wonderful woman and friend. I'm so honored to call you my friend, and I just love you and thank you for your time today. I know you're a busy woman.
My gosh, well, thank you. I echo all of your sentiments, and I am so honored and excited to be here. And I'm inspired by the work you're doing too, in your companies and as a mom and in your relationships. You've touched my life as well. So thank you.
Thank you. God bless. Take care.
Thanks. You too. Bye.
Bye.